What is your name and career?
My name's Fred Garcia, and I'm a physical therapist.
How do you use reading and writing on the job?
Well, reading and writing is probably the most important aspect of the job because we have to communicate to evaluation findings and plans of care to physician referral sources and to other therapists who may be treating those patients. So we use reading and writing on a continuous basis. You have to document everything that you do through reading and writing or electronic writing to justify what you do for each individual. That's how we get paid.
Where did you attend college and what courses did you take in order to pursue your current career?
I attended Angelo State University, Texas Tech University, and then for physical therapy school, I went to University of Texas Medical Branch in Galveston. Of course, all your basic courses before you get into PT school, including maths and science, chemistry, biology, anatomy, and then in PT school, but the major classes are pathophysiology, human anatomy with cadaver dissections, then all different types of specialty courses, orthopedics, neurology, things like that, as well as any patient management courses where you learn to actually deal with patients. Also, besides the coursework, we had to do clinical rotations as well, where you're actually working with individuals under the supervision of a licensed physical therapist.
How many years of college did you have to go?
It was about 6 years when I went. It's probably a little longer than that now. All the PT programs now are doctorate programs, so they're minimum of 6 years, probably 7 years of school.
How long have you had your current career?
About 26 years now I've been a practicing physical therapist.
How is it different now from when you first started?
It's changed some. Basically, more restrictions from the government, Medicare, and insurance companies restricting what's covered under physical therapy. But in some sense, it's restricted more. In other senses, or in another sense, it's actually expanded. Our Practice Act has expanded to allow to see patients without referral under some restrictions, depending on which state that you practice under. So that's probably the biggest change. But there's so many aspects of physical therapy, different areas that you can go into, and they've all changed. So and that may be one thing that's changed is more people are specializing in one particular area: sports medicine, orthopedics, neurology, pediatrics, something like that.
When did you know that you wanted to be a physical therapist?
Oh, it was kind of by accident. I was home for the summer and took a part-time job in the hospital working in the physical therapy department and just saw what the therapists there did and how they were helping people, and it looked like something that I would really be interested in. Previous to that, I wasn't interested in anything to do with the medical field. I was actually an engineering major, so I was more in math and science, but the field of physical therapy actually includes a lot of math and science as well, because you have to have a knowledge of joint mechanics or kinetics and stuff like that, just basic even anatomy and how the muscles and tendons work. Having a background in math and science really helped with that. So,
what advice do you have for someone who is thinking about pursuing a career as a physical therapist?
Probably the biggest thing is get some experience with it first, either volunteer work or part-time work as a tech, to try to get a feel for what some physical therapists do. Research it and make sure you know that that's what you want to do before you actually apply, because it is a long time. I mean, a doctorate program takes a long time. It takes a lot of money. So if it's not something that you really want to do and you're really going to enjoy doing, there are other fields out there that don't require as much schooling that you can make the same amount of money. I think a lot of students are turned on to physical therapy because it's a hot job right now. There's a big demand for it, and people see therapists working with elite athletes and stuff like that, and they think that would be a great job, but there's a lot more to it than that. So research it first. Be sure that's what you want to do, and if it is, go for it.